Urinary catheterization to relieve discomfort due to bladder distension or to provide gradual decompositions of a distended bladder. So first, introduce yourself and briefly to the client. Identify using emergency protocol. Explain to the client what we're going to do, why it is necessary, and how the client can participate. And also discuss how the results will be used in planning further care and treatment. And also perform hand hygiene. Good morning, ma'am. My name is Ridsel May Tumbaga. I'm student nurse from NDDU. Ma'am, pwede ko po ba malaman ang iyong pangalan? Okay po. Age niyo po? Birth update niyo po. So, before I start, I give my patients privacy. And also perform hand hygiene. So, ma'am, maghugas lang kog kamot, ma'am. Magbalik lang ko pag humana kog hugas og kamot. Next is verifies doctor's order to ensure legality of the procedure. Next, explain to the client what we're going to do, why it is necessary to gain cooperations for the patients and less anxiety. So, ma'am, andito po ako ngayon po, ma'am, para po sa iyong urinary catheter po. Itong catheter na po ito, may ipapasok po na para malambot po na tubo para po sa ari ninyo. So, sa procedure na ito, ma'am, gagawin po namin ito or natin po para po sa pagsusuri po ng inyong ihi po kasi nakalagay po dito sa doctor's order na meron kang pagbabara sa iyong sistemang pag-ihi. Also po, ma'am, para matest po namin yung ihi mo po. Okay po ba yun sa iyo, ma'am? May mga tanong ka po ba, ma'am? Next is place the patient supine positions to allow you to see and assess the urinary meatus. The urinary meatus is something difficult to visualize on human because it may symbols skin fold or another anatomical landmark in the area. Next, for human, flex the client knees and place her feet flat on the bed, like dorsal recumbent position. For the men, positions the client in a supine positions with a leg straight and slight apart. For good visualizations of urinary meatus and to have easy access to the sterile area. Also wear clean gloves to protect the nurse from contamination. So next, place the waterproof pad, rubber sheet under the patient's buttocks. This step prevents swelling of bed linens. So magbutang na kog sa waterproof pad, then rubber sheet po sa inyo, ma'am. Pwede po ba kayong mag-silent position? Okay po, ma'am. Ma'am, ilalagay ko na po. And also, I put a black blanket for my patient. So for the human, fold the blanket in a diamond shape. Wrap the corner around the client leg and fold the upper corner down over the perineum. And also for the man, cover the client upper body with a blanket. Fold the bed sheet down to expose the penis. So now I want to expose the perineal area. Also, I assemble all my necessary equipments to save time and effort. So, organize the working area for the urinary catheterization, positions the plastic bag or any gas receptacle so that you will not have to reach across the sterile field. And also, arrange the bedside table or the overbed table within your range to carrying contaminated object above a sterile field. I assess also the perennial care. Remove and discard glove, wash your hands or sanitize our hands. This procedure is to prevent contamination. Also don sterile gloves to maintain aseptic technique. For human, place the fenestrated drape over the perineum so that the hole is over the labia. For the man, place the fenestrated drips so that the hole is over the penis. And also attach the free-filled syringe to the indwelling catheter, inflations, hub, and test the balloon. If the balloon malfunction, it is important to replace it. So now I want to test the balloon. If the balloon is malfunction, it is important to replace it. To test the balloon po, I don't see any malfunctions of the balloon. So, to provide the patients from acquiring possible infection, for human, place the non-dominant hand above the labia and with your thumbs and fingers spread the patient's labia, pulling at the same time to expose the urinary meatus. If the labia slip back over the urinary meatus, it is considered contaminated. You will need to replace it cleansing procedure. And also for the man, with your dominant hand reach toward the opening in the penetrated drips and grabs the penis. Taking care not to contaminate the surrounding drips. So if the foreskin accidentally fall over the meatus or if you drop the penis during the cleansing, you must be repeat the cleansing procedure. So for these procedures, allow for the full cleansings of the area. Clean to dry principles prevent recontaminations of the cleansing area. And also with your dominant hand, hold the catheter approximately 7.5 cm, 3 inch from the proximal end, keeping the reins of the catheter coiled in the palms of your hand or make sure the distal end of catheter is in the candy basin. Next is inserting the catheter. From human, ask the client to bear down as no she is trying to void. Slowly insert the end of the catheter into the meatus. Have a client keep slow down breathe until the initial discomfort has passed. Inserting the catheter gently about 5 to 7.5 cm 2 to 3 inch, or until urines being too slow. For men, insert the catheter to about 17 to 22.5 cm, 7 to 9 inches, or until urine flow. So for lubricant the tips 1 to 2 inches from the female. And then for the male is 6 to 7 inches. So ma'am, mag-insert na ko ma'am. Bear down lang po. Next is the non-dominant hand. Hold labia open, penis to hold catheter in place. Inject the entire content of the free fluid syringe into the solve arm of catheter for the balloon inflation. I prepare amount of water insert to inflate balloon. And also retract the catheter until you feel resistance and move the administrated drips. And also attach the drainage bag to the drainage part of the catheter and hang to the bed firm, not to the side ridge. And also clean the client perineal area as needed and dry. For this, remove the residual aseptic solutions from the area. So to anchor the catheter, for the female side of the leg or upper thigh, for male also is to the upper abdomen or upper thigh. So for taping the catheter, help prevent urinary pulling. And also remove gloves and place patients to positions of comfortable. Also remove all the equipments and do aftercare. Wash your hand to prevent transmissions of microorganisms. And also change linen as needed, include swollen linen or linen that become damp during this catheterization, that to ensure patients' safety, comfortable, and privacy. Ma'am, i-remove ko na po ang mga blanket mo po, ma'am. Next is I want to discharge my gloves. And also perform hand hygiene. For evaluations, note any difficulty with catheter insertion and also note characteristic of the urinary obtained like amount, color, odor, presence of sediment or mucus. And also for documentation, document the time and date of the procedure. Document the size of catheterizations used and also record the amount of distilled water used to inflate the balloon. For evaluation, I asked my patient for some questions. So, ma'am, kamusta po yung feeling ninyo po, ma'am, na natapos na po natin ang procedure po, ma'am? Meron po bang problema or masakit po sa inyo, ma'am? Okay po, ma'am. If may kailangan po kayo, ma'am, pwede nyo po akong tawagan. Nandito lang po ako. Pwede mo din po ako tawagan dyan po sa lapil ninyo.